out here and you want to go horseback riding. So, you go out to this place that has all these horses that you can ride on, you ride around on them, have a good time.
Yep.
Well, you come into clinics and you see one of the horses there. And this is what you see. The horse just urinated, and that's what you got. They get the blood smeared back, and that's what you have. What are you dealing with? Could be, but you guys are nuts. Maple leaf toxicity. Did you see the clue? Did you see the clue?
Yes.
What was the clue?
The environment.
What was the clue?
All them red maple leaves
Yeah, all
out there.
this. Beautiful trees. Go up north this time of year, awesome,
Yes.
everywhere. Certain parts of Alabama, awesome, everywhere. Problem is that these guys, it's toxic to these horses. Now, we can eat it, and we can do, you know, we eat the maple syrup and all that, but even the bark, the leaves, the twigs, all of that is toxic to these guys. Why did I show you this? On Navily, that may be all you get, and then they ask you questions. Okay? These are Heinz bodies. Remember, Heinz bodies are denatured hemoglobin. They pass through the spleen, lymph nodes, they get taken out. The culprit or the compound that you find in the maple leaves, and it could be silver, it can be the sugar maple, any of the maple family, the acers. You see gallic acid. Gallic acid is a culprit. They also say that there's some nitrates in there, but they're looking more and more toward the gallic acid. And yes, this is an actual maple leaf that's been dipped in batter and deep fried. Deep frying makes everything taste good. Okay. Okay, red maple leaf toxicity is an oxidant-induced hemolytic anemia. So, no acer rubrum. Know that word or term. It's toxic in small amounts. They can eat a large amount and end up that way or dead, or they can eat small amounts over a long period of time. The leaves in September are worse than the ones or contain more gallic acid than the ones earlier on in the year. But any place that you have wilted maple leaves, you can have that problem. And this is just showing you what the gallic acid does in formation of disulfide bonds. It's irreversible. There's nothing we can give them to bring that hemoglobin back. So that denatured hemoglobin is now Heinz bodies. So what happens when these cells get denatured, or this hemoglobin gets denatured? Let's say you don't see the hematuria, or the hematuria. What else would you expect to see in these guys? Difficulty breathing, depression, flared nostrils, abducted elbows. And if you saw that without knowing that they were exposed to maple leaf toxicity or any of the other species that cause oxidant-induced hemolytic hemolysis, you would think you were dealing with what? What system would you first jump for? Respiratory. Okay. Acute anemia you will get within 1 to 2 days of ingestation of the maple leaves. Remember, it has to be a certain amount. And they say it's about 1.5 grams to 3.0 grams of leaves per kilogram of horse. So you're talking about 1.5 to 3 pounds of maple leaves for a 1,000-pound horse. Now, it doesn't sound like much, does it? Have you ever raked up leaves? You can get a whole bag of leaves before you get to a pound. You can get quite a bit. Let's say a bushel basket full. Okay? So that's actually a lot of leaves. So weakness, why would they be weak? Pardon? Speak up.
He said they don't have oxygen.
They're not what?
They don't have oxygen.
Right, lack of oxygen. Okay, why would they have red brown urine? Myoglobinuria? Hemoglobinuria, right. Why would they have pictured mucous membranes?
Because it's hemolysis.
What happens to hemoglobin in the body? How does the body recycle it?
Sharon said lysis of the hemoglobin.
Lysis of the red blood cells, releases the bilirubin.
Not bilirubin.
That's, you know what I mean. What's it called?
You skipped some steps. Okay, you got it. You're right. Okay. Remember, all that denatured hemoglobin causes the red cells to be taken out or torn apart. That releases free hemoglobin in the bloodstream. This is why you get the depression, and you'll also get a fever because hemoglobin is an irritant. The other thing is the body takes all of this and it directs it toward the liver. Liver breaks down the hemoglobin to recycle it. In that process, some of that hemoglobin is going to be turned into bilirubin. The body can handle small amounts of it. It's when it's overwhelmed that you start seeing it on the periphery, or you see it outside, or obvious signs of it. Okay? It is dose dependent. They can eat a small amount today. Well, doc, they don't eat it that often. They only eat it about once or twice a week. Still think maple leaf toxicity. When you look at their mucous membranes, it's a bronze color, but it's a grayish bronze color. And the blood, when you pull it, is almost chocolate brown, like Hershey cocoa powder. The urine, they call it or describe it as port wine, sorry people who like wine, or brownish black. And if all you saw was that urine, then you would suspect myoglobinuria, rhabdomyolysis. Heinz bodies, we already talked about that. Other things that can cause Heinz bodies formation, phenothiazine. I say that because it's depending on where you go. If you go outside the United States, you'll come in contact with this compound. It's used to deworm. Allium species can also cause it. This you see everywhere. Cut your mind, smells like onions. Onions, garlic, all those. Or in that family. And also the cabbage family too. Diagnosis is going to be based on your documentation of exposure. Well, doc, yeah, they cut some lumber over there or some timber, and I figured maple, we get maple syrup from it. Horses should be able to eat it. No. When you go out to these farms, you need to look around. Or ask the owner what kind of trees you have in there. And it may not be trees in the woods. They may have what do they call it? Not sculpture. But anyway, they probably redone their whole yard. The horse got out of the pasture, came into the yard where the ornamental acer bushes are, or trees, maple trees. It's usually seasonal, usually. That's what they're going to tell you in the books. That's classic presentation. It can happen any time of the year. Even if you don't see the Heinz bodies, that does not rule out maple leaf toxicity. This is why you have to get a good history. Ask about the types of trees and stuff that the horse may have come exposed to. Ask them what they do with all the leaves that they collect from their lawn care services. Where do they dump it? Can the horses get to it? If it happens acute, the owner notices them eating all that maple leaves, and they bring them in, usually that's a good prognosis. If you can get them within a couple of hours. Give them activated charcoal, followed with some mineral oil. What does the mineral oil do? It coats the mucosa, prevents further absorption. The activated charcoal will absorb whatever gallic acid or nitrates have been released. You want to put them on fluid therapy. Why? IV fluid therapy. Why? Yeah, keep the kidneys perfused. Just because you don't see a change in color in the urine doesn't mean that there's not hemoglobin in it. Blood transfusion if needed. Oxygen if needed. All those are basically symptomatic. Now, if they come in and they're depressed, they've gone off feed, owner thinks they're colicking, they urinate, you see that porrine urine, or there's a history of them being exposed to maple leaves, then if they're having difficulty breathing, put them on oxygen. You want to remove the sources. This is going to be, tell the owner, don't feed them this anymore, but for you, activated charcoal and mineral oil. You may want to give them a laxative. I usually give Epsom salts. It's wonderful stuff. You want to make sure that you give them balanced fluids. Don't just give them straight saline. If it's a, well, I'm not going to say that. Depending on what breed of horse you're dealing with and what other conditions they have, you want to make sure you want to get those fluids as balanced as possible. When you get your blood work back, that's going to tell you whether or not you need to replace your electrolytes. Why are we giving dexamethasone? Did you say one more time? Yes. You want to stabilize the remaining red cells that are there, as well as in the other tissues in the body, especially the liver and the kidneys. Ascorbic acid, we give them I give them ascorbic acid, vitamin B complex, because if they're depressed, their gut's going to eventually shut down. So I have to give them the vitamins and stuff that they're missing, those things that their gut normally produces for them. And you want to put them in a quiet, dark, and warm environment. Why? Think about it.
Don't want to stress them out.
He's extremely anemic. It's acute. His body hasn't adapted to it yet. Any little thing is going to set him off. So we want to keep it nice and quiet. We don't want to overstress him. We want it warm because they're not going to be able to regulate their own body temperature. If it's cold, we make it warm. If it's warm, we cool it down. Blood transfusion. If that hemoglobin, or if the hemoglobin level has dropped, or if the PCB has dropped significantly, then we need to go ahead and give them a blood transfusion. Got to replace those cells. Giving them hetastarch, it'll stabilize them, but it's not going to do anything for them being able to pick up the oxygen that they need. What's the dopamine for? Y'all had pharmacology, right? Okay, so dopamine. I'm gonna give them some dopamine. They haven't urinated since they got there. I want to get them to urinate. Dopamine is to help stimulate the kidneys, keep them functioning. I need to keep those kidneys functioning. Filtering out the blood, because if they shut down, it's going to be harder to get them to start again. For client education, the biggest thing is going to be prevention. Educate your clients against toxic plants. You might even want to consult with them, have a consult. You can charge them for it. There's nothing wrong with that. You go out there, you walk them through their land, or you have them have the extension vet walk through there. That's what they get paid for, to do things like that. So they can identify all these plants or potential problems, and then they can go ahead and take care of that on their own. You're going to monitor these guys over the next 120 days to make sure that they're stabilized and their kidneys don't end up shutting down. Because just to treat them and wait until the urine clears and then you send them home, you can do that, but you need to let the owner know we're not out of the woods yet. Give them 3 months. You want to make sure that they're on a good diet and whatever supplements that they need, and plenty of fresh water. These guys stop eating, remember, we'll end up in something else. hepatic, hepatic
Encephalopathy.
lipidosis. All right, I said there are other plants that can cause oxidative injury to the red cells. What's this one? Don't they cover? They do cover poisonous plants and tox, right?
That's not the day blooming jasmine.
Really? Yeah? No?
Is that
They mention it?
the day?
They tell you to go read it on
The
your
day
own?
blooming jasmine?
Jasmine?
The day blooming jasmine?
No. Onion plants. Wild onion. Usually what you see are just the stems. You don't see it when it flowers.
Give me the scientific name. I'll tell you.
Any questions?
Did you say they're wild onions?
Yes.
That's what it said in the book. And I've got them growing in the back, and when you cut them, that's what they smell like. They're in the allium family, put it that way. Allium species. Any questions? Okay. Case number 2. You go out to the farm, you called out to a farm, you go out on call with Dr. Newkirk. Dr. Newkirk looks at him and goes, oh, heck. This is what he sees. Depressed horse, low head carriage, not wanting to move, not really interested in his surroundings. You ask the owner, how long has it been like this? Oh, Doc, it happened overnight. You keep talking to them and everything and ask them when's the last time they ridden them, and it finally comes out that this horse has been like this for a couple of days. But they do send these guys out. They do tell you that all the horses got out and got into the woods nearby. Differentials. Or do you need more hints? You look at the eyes and this is what you see. What are you dealing with? 2 broad categories. Some kind of toxicity, okay, but 2 broad categories. Could be hepatic or it could be,
Lymphatic. Hemolytic. That's what I mean.
yeah, could be heme. Heme or hepatic. How you gonna tell?
Get a blood sample.
Yeah.
Get a blood smear?
Blood sample.
Okay, blood smear. You turn in your, well, I'll get into that. But we're going to talk about some common hepatic diseases. They all look alike. When they walk into your clinic or when you go out there to the farm, they all look alike. All you can say is he may have a hemolytic process going on or he may have hepatic problem. That's all you can tell the owner. It's not going to be until you get some more blood work or you do some further diagnostics that you can pinpoint which one it is. And then you have to do additional blood work or diagnostics to find out what the agent is, if you can find one. Okay, that's just to remind you we're dealing with the liver. Ew, huh? Liver. Tastes good fried. Anyway. These are FYI. You need to review all of your parameters for liver. Okay, all the enzymes and everything. I'm showing you this one because when they have a moderate to severe hepatic disease, you'll see a discoloration of the serum. So I usually take 2 tubes of red and let it sit. Let one sit and send the rest of them down the hill. This is called opalescence. I love that word. Opalescence or opalescence. It's wonderful. To me it looks like mother of pearl, but they call it opalescence. Some people say it's just milky white. Okay, that's Newkirk, milky white. Okay, so review your cytosolic enzymes and other enzymes and stuff. It's in the, I'm not even going to say it's in the notes anymore. You'll see it. So let's get to the good stuff. Common hepatic diseases found in horses are pyrolysin toxicity, hepatic encephalopathy, and some people say it's a syndrome, some people say it's an actual disease. Tomato. But I'm going to go over hepatic encephalopathy so you'll see why it happens. Thyler's disease, also known as serum sickness, they have now started calling it acute hepatic necrosis. Then you have hepatitis. What's the difference? There's a difference. Hyperlipidemia / hyperlipidosis, and then cholelithiasis. I have seen all of these except for hepatitis. Okay, common clinical signs, and these are varying in degree. It depends on how far along they are in the disease state. You'll see depression, they'll go off feed, some of them will even colic. This is for all the liver diseases. And like I said, hepatoencephalopathy, is it a disease or is it a syndrome? Basically what you'll see is head pressing. You'll see weight loss. The more it progresses, the more severe the weight loss. The more severe the hepatic encephalopathy, the more severe the colic, until these guys go sternal or recumbent. And then you'll see varying degrees of icterus. Less common signs that you'll see, but when you see them, they're really cool, not for the patient. Photosensitization, and I have some slides in here to show you an actual case that came in here. To this day, we don't know what he got into, but we'll show you. Photosensitization is the one that you'll see. In those that go recumbent, that's when you see that uncontrolled bleeding, so we have a coagulopathy going on, and you'll see dependent edema. You may or may not see the bilateral laryngeal paralysis. And these are rare signs, so we won't go into them. Okay, so the first one is going to be pyrrolizidine toxicity. Why? Because down here in the southeast, we have all of these plants and then some. Senecio is the big one, tansy ragwort. Amsynthia, Corvularia, Echium, Heliotropium, Cynoglossum, hound's tongue. All of it's down here, and this is what they look like. So if you see a slide, I'm showing, like again, as much as I can, I will try to, or attempt to, simulate the nablet. What they usually like to do is they'll show you a picture of a horse in a field of all yellow. And then they'll ask you what's going on. Wonderful, huh? So you have to have an idea of what you're dealing with. You can have some of this stuff where here's a rattle box, and they call it a rattle box because when these things mature and through seeds, the little seed pods rattle. They're the neatest things to play with. When you're out in the woods, there's no place you can go, no Xbox, and your mom says go out and play. That's what we did. We collected all these things. We even tasted them too. Stupid things we did when we were little. Some of this stuff, like this right here, you look at that, it's out in the woods. If it's out in the pasture, it's a weed. Do you know people are actually cultivating this stuff and putting it in their yards? This is why it's important for you to look at the environment that the horse is in or that the horse was in last time they were normal. This right here, they have put Cynoglossum, they've actually put in bouquets. Watch what you're sniffing. But all this stuff, this ground cover, they use this for ground cover. Horses will taste it. If they have nothing else to eat, they'll eat it. So you need to ask the owners what type of ornamental plants they have around the place. Okay, the clinical signs of pyrrolizidine are progressive. They'll start off mild, and they will progress if we don't institute some intervention. It'll get to the point where they start manifesting signs of liver failure. Okay, you can see the icterus, no big deal, but then they'll start seeing the weight loss. Some of these guys will actually circle. In about 80% of the cases, you'll see bruxism and aimless wandering. If you see aimless wandering, what other disease should come straight to mind immediately? Rabies. Okay? I've seen horses that aimless wandering and holding feed them out. First thing that comes to mind, rabies. Weight loss, usually weeks to months. You'll have behavioral abnormalities, which is what we had in the one case that came in. And sometimes these guys can have an uncharacteristic aggressiveness, which was also seen in the case that I'm going to show you. This neat stuff, I'm telling you. And we got other signs. Yes? It'll be a change in personality, and usually, a change in personality, and sometimes for a certain breed, like you got laid back, most of your draft horses are laid back, but they're all of a sudden, this one's aggressive. The stallions, they tend to be a little bit more aggressive. Mares with babies tend to be a little bit more aggressive because they're being protected. But for the most part, it's going to be from what the owner says, but it's also going to be based on your knowledge of the breed, because sometimes the owners don't know. Oh, Doc, I just got him. Well, I just saved him. I just rescued him. Okay, so what happens to this? You eat the plant, well, you don't eat the plant, the animal eats the plant. We get a cross-link in the DNA, the ddNA, and it binds to proteins and nucleic acids. It prevents these guys from doing what they're supposed to do. It has an antimitotic effect on these guys so they don't divide. And you get these huge liver cells called megalocytes. As these megalocytes die, since they can't replace themselves, because they can't undergo mitotic division, when they die, they're replaced with fibrotic tissue. So in the more severe cases, when you do your biopsy, you'll see a lot of fibrosis. And that just gets you, all this stuff, the pathophysiology and everything is for you so that you can better understand the disease. As well, and all of this that you see here is what you'll see on slides. You won't see it on slides, but this is some of the stuff that they'll report on your, what do they call it? On your results. But they basically tell you what they see and what it might be. Diagnostics, this is what you need to know. History. History is important. You need to ask them what they've been around, what's out there in the pasture. Clinical signs will key you in too. If they got icterus, hemolytic anemia, or hepatic disease, you don't know which one, but you need to start thinking. CBC, fibrinogen, serum chemistries are what you want to send in. CBC, when you do a smear, it'll tell you whether or not you got Heinz bodies or any other bloodborne parasite. Fibrinogen will tell you if it's an active infection, because that's what, an inflammatory protein. But the serum chemistries are what's going to key you in. You're going to have an elevation in the serum chemistries. And wherever you have, if you have the ability to do bile acids, you won't see an elevation in bile acids in the beginning, but about a week, they say anywhere from 5 to 10 days later or after ingestion, you'll see an elevation in bile acids. Rule of thumb, when the bile acids reach around 60 to 90, you need to start thinking hepatic problem. Normal is around 30. Prognosis, poor to grade. If it's an acute case, you just get them in there. The owner saw them eating this stuff. They brought them in, Doc. I read somewhere on the web that it said that they could have a liver problem, and I want to make sure that we treat them for a liver problem. Well, if they just ate it, then we go ahead and we do what? We give them activated charcoal, we give them mineral oil, and or Epsom salts. We got to get that stuff out of them so they don't break down anymore. Yes?
If you're giving mineral and charcoal, is there a specific order you want to give that in?
I say yes, but when you talk to a lot of people, they say, oh, it don't matter. The mineral oil will coat the activated charcoal and deactivate it, or leave it, useless. What I say is, what I would do, and what I was taught is, if you're going to give activated charcoal and mineral oil, you have to decide which one's going to be more important. For me, it would be the mineral oil, because it's immediately going to coat everything. However, if you think or you have a suspicion that it's what they call lipid soluble. Some people say give the activated charcoal first. But if you do, whichever one you give first, you give 2 hours in between. I like to give it all at once, and I'll tell you why. Because you're going to ask, you want to know why? I'll tell you why. I use the charcoal. When I give both of them, I use the charcoal as a marker. 2 things. First I'll give the mineral oil, then I'll give the charcoal. I use the mineral oil is going to coat everything. Take it out, right? The charcoal is not going to coat everything. It's going to come into contact with whatever it meets, whatever ingest is there. It's going to mix in. So I'm using it as a marker because when the charcoal starts coming out, that means that everything he has eaten prior to coming to me is out. So that's a peace of mind for me. So, but yes, you can give them both. And yeah, if the mineral oil does deactivate or render useless the activated charcoal. IV fluids, we put them on IV fluids because 9 times out of 10, or most of the time these guys come in, they haven't eaten or drank anything. So we need to get fluids on board. It also helps to flush out whatever toxins that might be in there. We give them non-steroidal anti-inflammatories. Some people say, it might cause more problems. Problem is that all of these toxins result in some type of inflammation. I need to get that inflammation under control. I need to make my patient feel better. Well, why don't you give them dexamethasone? You can give them dexamethasone, sorry about that. But you still have to look at the long term. You can't give them dexamethasone every day. But non-steroidal anti-inflammatories, you can. Diet. You got to make sure that these guys continue to eat. You got to get them eating. So I will put vitamin B complex on board. Some people will just give vitamin B12 and maybe CRI, some diazepam. Anything to stimulate their appetite. You got to get them eating. When you start feeding their diet, you want to make sure that it has a low amount of a high quality protein and lots of roughage. Stay away from the grain. A low amount of a high quality protein. And you want to make sure you got you want the high carbs in there too, because they're expending a lot of energy. All the tissues are. So, I think this is my case. Dakota, horse that came in, he actually lives out here in Tuskegee. They keep him over where that new hospital is being built. Before that hospital was there, it was nothing but a wooded area. Owner turned him out all the time. He has 3 horses, never had a problem. Until this one day he goes out and he's dealing with a horse, and the horse is unusually aggressive. I mean, coming after him. Uncharacteristic. Not eating, he's just aggressive toward anybody and everything. They call Dr. Newkirk, Dr. Bridges. First, Dr. Bridges goes out there and he's like, oh man, this horse might be ratted. Goes back, gets Newkirk, and they go out and they both stand there. Boy, this horse might be ratted. Okay, they do more stuff too, but it sounds more fun when I just say that. So they do initial workup and everything. They tell the owner, after they give him some Banamine and some antibiotics and all, they ask him about poisonous plants or anything else he could have gotten into. Vaccination history, everything is done. Everything's in place. He had a rabies vaccine. Been getting a rabies vaccine there since he was 3, and he's 10. Okay? So that kind of moves it down, but it doesn't, moves rabies down, but it doesn't take it off the list. But when they look at the eyes, the next day, now they're ictering. So they tell him to bring him in. He urinates, and that's what you see. Looks like gold, don't it? I had to take a picture. I took lots of pictures of this stuff. But this was the best. Stainless steel bucket with golden urine. Looks like a golden ale, doesn't it? Anyway. When he walked in the door, this is what he looked like. His skin, he was so dehydrated that his skin was corrugated, right? That's part of it, but not all of it. When you pulled up the skin, it tinted and it stayed there. But he walked in with his skin looking like this. So we dropped the catheter, started him on some fluids. After we pulled all his blood, started him on some balanced fluids and all. Notice all the white. This is what his face looked like. Looked like he got a chemical burn. And when you see a horse that looks like this, you need to think chemical burn. That should be in your differential list. Problem is, what? Where is that burn?
Only on the white spot.
It's only in the white. So now you're thinking what?
Photosensitization.
Photosensitization. Ooh, who is this person? Y'all just now noticing? Oh my gosh. Anyway, so this is just to show you that this case actually came in-house. But anyway, we did not drug this horse. This horse is not drugged. He is extremely depressed. He is an intact stallion who is normally a very good guy anyway, but he wasn't feeling it that day at all. Okay? Feces that came out, hard and dark. Dark and hard. No mucus. So what we did was, we never peeled off all the skin. All we did was we trimmed whatever was loose off of there. This is to allow the underlying skin to breathe and to heal. This is just part of what you do. He had these lesions all on his legs, all over his back, his chest, his face, and his previews. Think he was painful?
Yeah.
Right, so what are you going to do about it?
Drugs.
Aloe is wonderful. Zinc oxide, hashtag diaper rash ointment. Wonderful. But the zinc oxide gets a little bit expensive, so we use a combination of everything. This is, I think this is the third day. I think it's the third day. He's well hydrated, but look at what his skin is doing. What do you think is happening? Oh, wild guess. The skin's dying. Okay? The skin is dying, and he actually has pockets where there's nothing but air, and it's hard as a rock. But we do not cut it. We don't do anything, because what would happen if we start cutting into this and removing things?
Infection.
His skin is intact at this point. Infections. And then you'll have a whole new problem to deal with. So we basically left the skin intact as a bandage. And every day it got worse and worse and worse. He basically looks like a wrinkled blanket. Sorry about the fuzz on here, but it was in the middle of the summer, and I went from cold to a hot stall, so my lens fogged up. But I didn't notice it. He started peeling his skin. Having been left alone, you can actually see where it started to peel. That's when we start trimming back. What's the wonderful thing that we see?
It's pink.
Come on in there. All this.
It's pink.
It's nice and pink and healthy. This is 8, let's see, 3, 5, 3, 16th day. 16th, 17th, somewhere around there. About 2 weeks out. This is where us just trimming back all of the dead skin as it starts to peel, even around his fetlocks and his coronary band. And you can see he's turning into a brown and pink piece of candy. And this is when he went home. So, how are you going to what you going to tell the owner?
Keep out of the sun.
Keep him out the sun.
Keep out the sun.
Keep him out of the sun. Yes, yes, yes. So, how are they going to do that? Because he's out in pasture and they don't have a barn.
Yeah, you can put a blanket on there.
Get him those sheets. Get him a sheet. They have these light summer sheets that you can put on there. And he looked really funny because he had the whole head and covered the ears and the whole shot. But he had a full-blown, basically, sheet blanket on. And the horse was smart enough because whenever you're out in the heat, or whenever he was out in the heat, if it got hot or if he was in direct sunlight, his skin would start to burn and he would head straight for the woods. And he found a little area with a cove that he would just kind of sit there and wait until the sun went down. But if they don't have something like that, the owner has to provide. And at this point, you really don't have to doctor on him. The only thing that we told the owner to do is invest in sunscreen. for your horse. Any questions? Where am I? Oh, 2 minutes. Any questions I shall entertain? Yes.
Does the owner not keep using Ado on the areas that are still peeling?
Actually, he's not. He actually, hey, y'all can't hear me. The question was, is the owner still using aloe and stuff on it? Because this happened when it was, I forgot the date on that. 2015? I don't know. Let me see. Oh, 2011. It happened in 2011. Even to this day, he can't be out in the sun long. And the owner knows that. So the owner rides him early in the morning before the sun rises, or late in the evening when right before the sun sets, or if it's cloud covered. What he will do is, if they're going to be riding for any long distance, he will put zinc oxide over his face and nose. Okay? The big thing is, I talked about diet having low amounts of a high quality protein. What they have found in the New England Journal of Medicine for people, and the same thing holds for horses, is that not all of our patients that have hepatic disease need to be on that low protein diet. The only way that we can find out, because this guy is on a normal diet, he eats anything and everything. But the way to find that out is give him 3 months on the special diet and then slowly increase the protein. The minute it looks like they can't tolerate it, they start having recurrence of clinical signs, you stop. This is a horse that can't tolerate it. So you have to go back to the low protein. But this guy went back to it, and I think out of all the horses, all of 10 horses I've seen since I started veterinary services, only one had to stay on a high carbohydrate, low protein diet. So you never know which one it's going to be. And with that, I shall end. I think 2 a day is enough.